The President. Good morning. The motion debate now resumes. Dr. Wing-kwong. President, I thank Professor Chan for moving the motion and the other three members for their amendments. The development of CM has a very long history in terms of preventive care and rehabilitation. It has been very useful, especially during the 3-year pandemic. Local and overseas clinical results show that CM has made significant contribution to fighting the epidemic. Now, the country has announced the development plan for Chinese medicine and stressed the integrated development of Chinese medicine and Western medicine. The country will promote high-quality development of CM by professionalization and industrialization for better protection of people's health. Now, in Mr. John Lee's first policy address, he stressed the role of CM should be enhanced. The subsidized quota for CM outpatient services will increase from 600,000 to 800,000 per year, and more resources will be allocated to strengthen its role in primary health care and DHCs. Now, with the aging population in Hong Kong, there will be more and more chronic disease patients. Public hospitals are stressed to the seams. Now, CM can play an important role in supporting our public healthcare system, but the development is too slow. The first CM hospital will be commissioned only in 2025. The BPA urges the government to adopt a multi-pronged approach to strengthen CM's development, to better protect people's health and alleviate the pressure on public healthcare system. First, we should incorporate CM in public healthcare system and primary healthcare. Now, CM should be formally subsidized by the government so people can pay less for CM treatment. And also, the government should work with the CM trade to promote the strengths of CM in preventive care and rehabilitative care. And this will also help triage patients from the public healthcare system, which is facing manpower shortage. Now, there should be numerous measures on promoting ICWM. On the mainland, ICWM is very sophisticated. There are post-secondary institutions training medical students with Chinese and Western medicine knowledge, and also there are ICWM research centers. We can learn much from them. Now, on the contrary, we are progressing very slowly. In year 2014, the HA implemented the ICWM pilot schemes to offer ICWM services for patients under 3 disease areas. Now, the scheme has been extended to cover 8 public hospitals. Now, the government should extend the scope to more disease areas and regularize the program. And also, there should be health record interconnection between the Western and Chinese medicine sectors and more multidisciplinary collaboration. Now, we should also enhance the qualification framework and training for CM practitioners. Now, more resources should be allocated to clinical research on CM, and we should also make reference to our neighbors and enhance the examination and registration mechanism for CM practitioners and CM pharmacists to attract young people to join the trade with prospects. Now, the government should also work with the trade to deepen regional collaboration. Now, according to the construction plan for the GBA CM Highlands 2022 to 25, the Guangdong provincial government is supporting 7 CM research institutions to hire Hong Kong CM practitioners on a trial basis to absorb them into the national mechanism. And also, proprietary CM drugs registered in Hong Kong can be registered and sold in the mainland on a streamlined basis. Now, Hong Kong has much collaboration opportunities with other GBA cities in terms of mutual recognition of CM practitioners and also standard setting for CM drugs. I so submit. Thank you. Mr. Rokshan. President, I speak in support of Professor Chan's motion. Now, to treat disease, we have to act before the disease sets in. Now, this is the theory of CM. Now, we have an aging population and also manpower shortage in the healthcare system. It causes an imbalance to our public healthcare system. Now, under the epidemic, our healthcare system was close to bursting. CM played an important role in helping the situation. Now, under the policy address, the government has laid down a plan to tie in with the National Development Plan for CM. I have 5 suggestions. First, we should increase funding allocation for CM development. Now, our healthcare system is mainly relying on Western medicine, but CM can be very beneficial in preventive care and reducing the number of patients. However, the resources allocated to CM is pitiful. Now, the allocation of funding to HA only accounts for less than 0.2% in total funding. More resources should be allocated on enhancing the role of CM on preventive care and community health so that chronic disease patients and people with minor diseases can be treated with CM services. And this will also serve the triage purpose. Now, the public sector CM services has 2 components. Now, we have the CM CTRs, that is the Chinese medicine clinics and training and research centers, and also ICWM. However, both components are underwhelming. Now, among the 43 participating institutions, only 8 of them are public hospitals, and the selected disease areas are only cover stroke care, musculoskeletal pain, and also cancer palliative, and it is only limited to inpatients. Now, we have to extend the ICWM to more public hospitals and increase the number of selected disease areas. The service targets should also be extended beyond inpatients. Now, we have to enhance CM services in CM clinics. The government has been subsidizing CM services in the 18 districts through CM CTRs. However, they are operating on a self-financing model. Every year, only 600,000 to 800,000 service quotas are subsidized. However, patients have to pay $120 for each attendance, compared with the $50 price for Western medicine. It is a bit expensive. So I think the government should rejuvenate the CM services in public sector to benefit more people. Now, on escalation ladder, after graduating from CM programs, there are not much internship opportunities for young people. Now, after the commissioning of the CM hospital in 2025, the gap can be filled. Now, the government must continue to enhance interaction between the trade and the research sector and the academia. These research institutes will become the base for training up talents. Now, only then can we enhance the clinical quality of our CM services. Now, in terms of talents, the government must attract more quality talents to join the CM trade and inherit the wisdom. Now, I think we should review the manpower projection so that CM practitioners can undergo continuous learning, and also in more medical school, students should be taught Chinese medicine theory. This will help modernize the CM discipline. I so submit. I support the motions and the amendments. Mr. Lam Chun-sing. Thank you, President. I thank Professor Chan for moving this motion. Now, during the epidemic, CM has been proven to be very useful in triage and preventing COVID onset. Now, we have to allocate more resources to the trade. Now, we will have the first CM hospital in Chun-keung. It is an answer to the long-standing aspiration for more CM services in Hong Kong. Now, ICWM is a crucial component. Now, in year 2014, the ICWM pilot scheme was launched to alleviate the medical the pressure in the public healthcare system. Now, 9 years on, only 8 public hospitals and 7 Chinese medicine clinics are covered. There are only stroke care, musculoskeletal pain alleviation, and cancer palliative as disease areas. Now, there are plans to extend the scope to more disease areas, but it is too slow. And also, the charge is not attractive. Now, in year 2020, there were only 3,300 patients participating in the scheme. Now, we cannot accumulate sufficient clinical experience to support the CM developments in Hong Kong at this pace. Now, more hospitals should be covered, and more disease areas should be included as well. More subsidies should be given to patients. Now, this will allow more patients to benefit, and also more CM practitioners should be allowed to join the scheme for experience accumulation to meet the future demand for CM developments in Hong Kong. Now, we also have ICWM in medical schools. Now, in CUHK, we have the Chinese and Western Medicine Center and also the Tonghua Group of Hospitals ICWM Center. Now, I hope tertiary institutions can collaborate more with the Chinese medicine trade to enhance mutual understanding between Chinese and Western medicine practitioners. Now, there should be a mechanism in place so that patients can undergo Chinese and Western medicine treatment simultaneously. It would be much better than patients undergoing one kind of treatment, both kind of treatments without telling the doctors what treatments they have received. Now, talents are very important for CM development. Our CM talents are mainly from the 3 local universities. Now, the government is going to increase. The government is reducing the number of first-year degree places for CM programs in the 3 universities. However, the government is increasing the number of CM talents imported under the talent schemes. This is very peculiar. Now, the CM practitioners are hired by NGOs. Some organizations did not adjust the remuneration package for CM practitioners upward according to the HA's guideline. Now, most CM practitioners are at the low to mid rank. There is not much room for progression in their career. The situation has to be addressed. The government should enhance the articulation and progression pathways for CM practitioners. Now, besides training, auxiliary professions in relation to CM, like tweener, should also be given attention. Now, there are acupressure and tweener services. Many tweener operators cannot register their business under the massage parlor legislation. Many of them are being viewed as vice trade. Now, this situation should be addressed. There should be an accreditation system and also a regulatory system in place. I support the motions.
Ms. Starry Lee, good morning, President. We have a serious shortage of healthcare professionals. That's a long-standing issue that remains unresolved. We have an aging population, and we also have a worker shortage and worker loss. That means growing pressure on the healthcare system. We have 8,000 or so registered CM practitioners, less than 10%. It's actually 5.1%. actually work in the public healthcare system. It's obvious that the government needs to make better use of the CM practitioners, incorporate them into the public healthcare system, attract CM talent that will help take pressure off the healthcare system. And this can also help address the service gap in CM services. This will also ensure swifter access to treatment for patients. I thank Professor Chen for his motion on promoting CM to ease the pressure on the healthcare system. Due to time constraints, I want to focus on strengthening the collaboration between CM and Western medicine. Now, people are more familiar with Western medicine. COVID changed things, though. People have come to see CM has worked in treatment. There are differences between CM and Western medicine. More people want to see more elements of CM in the public healthcare system. That way, CM can complement Western medicine and the other way around. Now, the collaboration of CM and Western medicine is by no means novel. 2014, that was the year when there was a pilot scheme for stroke, cancer, and musculoskeletal conditions. There was the collaboration of CM and Western medicine. But let's look at the figures. Little progress. 43 public hospitals, only 8 of them public hospitals they take part in the scheme, and just around 3,000 patients take part in the scheme. We know that the collaboration is the most optimal treatment for patients. CM and Western medicine each has their own strengths. In our public healthcare system, we need dedicated CM units. This will mean more services from the integrated scheme, and that will benefit patients in the end. The first thing we need to do is for the government to be more active in promoting integrated CM and Western medicine. As I said, the general public turns to the Western medicine practitioners. They simply judge from their experience or what they find out from the community about CM. So the government needs to be more active, especially for the current term government, to play a more active role in promoting CM in the community. And second, we need to expand the diseases covered by the integrated CM and Western medicine scheme. 3 conditions are far from enough. You need to give play to the strengths of CM in other diseases. My experience shows that for internal medicine, for women especially, in terms of the hormone-related disorder, CM actually works greatly. For eczema, the Western medicine's strength lies in clinical diagnosis, but different people have different bodily conditions. Now, their conditions fluctuate over time. CM can come in here. The CM has regard to the conditions of different people and offers health maintenance. So this is where CM and Western medicine can complement each other and ease the conditions. The same goes for diabetes. Now, the integrated treatment plans work very well, and it's scientifically based. I hope that Secretary for Health can respond to these points in a moment. On integrated Chinese and Western medicine, this is where we need to open a new chapter. President, I so submit, I support Professor Chen's motion, and also I hope that the current term government can start a new chapter and bring in more new opportunities for integrated treatment. Ms. Connie Lam. Thank you, President. First, I thank Professor Chen for his motion and also the amendment. During COVID, CM played a key role in treatment, now, such as the 莲花清瘟 capsules, 金花清滚 granules. The ingredient helped ease COVID symptoms. The government will hire someone to serve as the Commissioner for Chinese Medicine Development, the coordinated policy development, making the blueprint for CM development. But then in raising a profile of CM and also publicizing CM, there are areas we can do better. Here are my suggestions. CM practitioners and Western medicine practitioners, they should get the same referral rights. Currently, there is no referral right for CM practitioners. They cannot refer patients to different clinics. for tests, lab tests, or X-ray services. For CM practitioners, if they have to take other means to find out the conditions of a patient, and the patient has to turn to another Western medicine practitioners for a referral letter, for tests or other examinations, etc., that will mean more costs for the patient, and it will be more time-consuming. Giving CM practitioners referral rights will give the practitioners more options, and this will also ensure timely treatment for the patient. Now, on expanding the integrated Chinese Western medicine schemes, back in 2014, the first phase of the integrated Chinese Western medicine collaboration scheme came out. At 8 hospitals, that pilot scheme was running, and it covered cancer, palliative care, stroke, and musculoskeletal pain management. The result turns out that CM worked in improving patients' health, such as pain, sleep loss, and also fatigue. The pilot scheme worked in assisting patients' treatment. So the scheme should be expanded to cover other public hospitals and clinical facilities. We can also cover more medical items under the scheme so that we can provide better treatment for patients. The government also promulgated the primary healthcare blueprint. The proposal is to turn the focus from treatment to prevention. The prevention and management of chronic diseases like hypertension and diabetes matters. In managing chronic diseases, CM works well. Now, there will be a chronic disease co-management pilot scheme. I suggest that the government can do integrated Chinese and Western medicine to manage chronic diseases like diabetes. In Chun-keung, there will be the first CM hospital. In 2025 Q2, the hospital is expected to be commissioned. This hospital under construction will give a boost to CM development. It will also raise the profile of CM to give people another option so that people can turn to not just Western medicine practitioners, but also CM practitioners. Now, this hospital is also a starting point in the government's attempt to incorporate CM into public health care. We should expand the scope of CM services such as rehabilitative care. We can have acupuncture and other CM services, and also the integration of Chinese and Western medicine practices that will mean better care for people. Across different districts, we have district health centers and also district health stations. Now, there are health risk assessments, and also on chronic diseases like diabetes or hypertension. So at these DHCs and also district health expresses, we can also do Chinese medicine services. This will help people prevent and manage the chronic diseases. Now, on the professionalization of the CM sector, now there are no specialized training and professional recognition for CM practitioners. There's a lack of standard certification, recognition, etc. So on professional training and qualifications, there is a gap. The system fails to reflect or recognize the clinical expertise or experience of CM practitioners. So I argue for a professional registration system for CM practitioners. So on orthopedics, acupuncture, moxibustion, or pediatric gynecology, we need professional recognition for CM practitioners. President, I agree with the motion and the amendments in the directions. I also hope that the government can adopt our ideas in promoting CM development. That way we can provide better care for people and also ease the pressure on the public healthcare system. President, so submit. Ms. Lillian Kwok. Thank you, President. I thank Professor Chen Wing-kwong for his motion on actively promoting the development of CM to alleviate the pressure on the healthcare system. Now, practicing medicine is something we are all familiar. CM has thousands of years of history. It has unique theories, and it has also unique in its practice. History shows that CM works very well in prevention, treatment, and rehabilitation. Many people believe CM actually works in treating the symptoms and also curing the root of the diseases. We had 3 years of COVID. Our healthcare system was under immense pressure. CM came in and it played a key role. On minor illnesses, recovering patients, CM treatment worked particularly well. During COVID, CM's contribution was well recognized. We have an aging population, there's pressure on the public healthcare system, and it's growing by the day. In view of that, I believe the government should consider the population changes, make good use of our country's medicinal tradition, make a long-term policy to ease the pressure on our healthcare system. So here are my suggestions. First, improving the sharing health records and referral system. Back in March 2016, that was when the e-health went online. Now there was recording of diseases and sharing records. Starting from March 2020, the CM sector could sign up for e-health. Then EC Connect came out. It was a clinical management system supporting CM clinics in their day-to-day administration and running. The government has relevant plans on the sharing of electronic health records, and that has taken into account the CM needs. And I also suggest that the government can improve these systems to make it easier for medical institutions to access health records. And there's also a need to review the referral system. That way, CM practitioners can refer patients to other medical professionals. So that's how we can put the interest of patients first, and that's how CM practitioners can truly, and Western medicine practitioners can truly complement one another. Now, on training, we have 3 universities offering bachelor's degree courses in CM. In CM, 18 places, Hong Kong U 18, and Hong Kong Baptist University is 20. So 56 in total every year. In 2020 year, or before, each year, there were actually 24 slots, in total 72 each year among the 3 universities. The government wants to promote CM development. Local talent training is a key point. Now, papers show that actually we are seeing a 20% drop in the training places. It's actually a 22% drop. So can the government reconsider this matter and re-evaluate the future development of CM and readjust the number of training places in CM bachelor's degree programs to train up the talent we need? Third, now we need specialty training for CM. Now there are different specialties in CM as a discipline. Now we can make use of the different specialties to make sure patients get the right CM practitioner. There are gynecology, orthopedics, etc. You can have different specialized CM practitioners. So the government should consider ways to promote specialization among CM practitioners. We can have continuous development courses so that we can have different specialties. This way, we can have specialty care for different patients. This will help raise the professional profile of CM practitioners. And finally, we can benefit the patient. Fourth, we need to step up education at schools. CM is part of our traditional culture. We need to expose children to CM culture from a young age, let them learn about CM. That will help enhance the young generation's national identity and help them take pride in our country. This can tie in with life planning, make use of technology in the education, so the people learn about the Chinese medicine drugs. Make it like a game. You can use apps, software to do the activities. You can take students to CM clinics. Hospitals can hold talks at schools. And then at the senior secondary level, the government can consider letting students do internships at CM clinics or hospitals. That way we can start career planning early on and show people a career path. President Xi Jinping said that CM knowledge is a valuable asset of our ancient science, and this is also a key to our treasure of knowledge. I strongly urge the government to treasure this body of knowledge, make use and make good use of CM as a discipline. Please stop.
Mr. Chun-keung. Thank you, President. I want to say that I support Mr. Chen Wing-kwong's motion to promote CM and to alleviate the pressure on the healthcare system. Well, we have weathered the impact of the COVID-19 epidemic, and on the part of the public, they are now even more receptive of CM and the treatment efficacy. Well, CM has been very useful in helping us cope with the epidemic. And also CM is very useful in treating chronic diseases. Although the administration has devoted some resources into the development of CM, but given the latest situation, should more be devoted by the administration to CM? I believe when this subject was brought up in our panel discussions, most members gave their support to Mr. Chan's motion. In all the 18 districts, we have a clinic, training and research center, but it's just one in every district. There are too few of them. My constituency is NTEs covering Chun-keung, Shatin, Tai Po, and the Northern District is about 1/4 of the total of Hong Kong. And there are only 4 CM clinics there. Don't you think there are too few of them? The government should set up more large-scale CM clinics to meet people's needs. In promoting our CM and CM education, Hong Kong enjoys certain advantages because we have leverage on the mainland as our hinterland, and we can connect with the rest of the world through Hong Kong. And we have made good achievements in CM in recent years. The clinical experience we have accumulated can be applied to the treatment of diseases in Hong Kong. I understand the administration is promoting exchanges between the CM trainees in Hong Kong and their counterparts in the Greater Bay Area. I believe such exchanges can help the development of CMs in Hong Kong. There is also a visiting scholar scheme from the Greater Bay Area, inviting CM practitioners to share with us the experience so that the medical sector, especially the CM sector in Hong Kong, will benefit from this. This is going to benefit the community as a whole. And the third point is about CM medicinal products. Earlier, I went to Vietnam and Thailand with Chen Hang-pan. In Southeast Asia, CM is widely accepted. But when they try to buy the Chinese herbal medicines, they are not quite sure about the quality of the medicines. But we have set up a standard for the accreditation of standards and quality. So we are in a very good position to offer them this service. So apart from clinical treatment, Chinese herbal medicine, is an industry in its own right, and we can cooperate with industries and practitioners in Southeast Asia. So the administration should consider how we can make the best use of the Chinese medicine standards in Hong Kong. Thank you, President. I would like to thank Mr. Chen, Professor Wing-kwong, for moving this motion and the other members who have moved amendments so that we can have a debate on the development of CM in Hong Kong. CM is a traditional culture. It's the fruit of our ancestors' wisdom. There is the plan on the part of the mainland to construct, that is the promulgation of the construction plan for the Chinese medicine highland for the Greater Bay Area. And during the COVID-19 epidemic, CM has been very useful in alleviating the pressure on the healthcare system. And we have a very good import and export industry and a very good laboratory system. So in terms of testing, R&D, and in commercialization of R&D results of CM medicine, we are in a very advantageous position. We should share with the mainland the relevant strength and results. In the mainland, there are many high-quality CM hospitals. So there's a great potential for collaboration. So that's why I want to promote further collaboration with the mainland and also greater degree of commercialization should be applied. So I would like to propose that in the northern metropolis that there should be a research highland for CM, and we should establish cooperation with major cities in the mainland for collaboration in CM. And there should be a demonstration area set up in the mainland for the growing of Chinese herbal medicines and also to support the R&D in Chinese herbal medicine. And there are major provinces in the mainland with very good CM production basis, which is set up specific in cultivation park or for the growing of Chinese herbal medicine, and such medicine and herbal medicine should be tested to Hong Kong standards so that we can establish high value added export of Chinese medicine, herbal medicines. Well, these major provinces specializing in CM will be our good partners. And the northern metropolis can also establish R&D and demonstration area. And then we can partner with major CM-related provinces in the mainland for the joint ventures to export, to grow, manufacture, and export such herbal medicines. And there should be a regular exchange mechanism between the two sides. There should be a good communication channel to support the further development of CM. And the governments on both sides should take the lead so that we can have better Chinese-Western medicine collaboration and also industrial collaboration. Views should be freely exchanged and communicated, so that we can make sure that there's good progress in collaboration. On this basis, through seminars, these conferences, or duty to visit tours, officials on both sides, medical experts, and entrepreneurs can talk to different stakeholders to promote collaboration. To promote the industrial collaboration, we need to seize the opportunity now. We hope that this collaboration with the mainland will become part of the plan for Hong Kong CM development and also for northern metropolis. And there should be support in terms of funding and policy. President, with this remark, I support the motion and the amendments. Mr. Tang Fei. President, I rise to speak in support of Mr. Chun Wing-kwong's motion and the amendments moved by other members. We have a law on regulating CM, but this is a regulatory legislation and not for promotion. In 2016, well, China has set up a law on CM, and there are active measures to promote CM, and important principles are set out in the law. Therefore, Hong Kong SAR government should set up more policies, measures to develop CM to help the general public. Other members to talk about the importance of setting the salary scales and promotion opportunity for CM practitioners. Well, CM is a mature system in terms of diagnosis and treatment, and people do have confidence in this industry. But there are two difficult points. First, CM to collaboration and integrated CM Western medicine treatment, and also standardization of various medicines. Since 2014, 2015, the HA launched the Chinese Western medicine collaboration scheme. 7 clusters of HA were involved. It seems to a rather big-scale operation. There are experts from both the CM and Western medicines. They will come up with a clinical treatment and offer them patients CM on cancer treatment and stroke patients and other chronic diseases. Well, but the coverage is too small. And this is a pilot scheme. It seems that they have not announced the assessment result of this pilot scheme. Well, a collaboration or the integration of CM and Western medicine doesn't mean that you place CM practitioners and Western medicine practitioners in the same hospital, and that would do. And what if there's a referral from a CM to have some diagnostic judgment, and if it's diagnosed to be a cancer stage 1, what would happen next? Will the Chinese medicine practitioners follow up with the treatment, or should the patient go to a Western medicine practitioner instead? And there is also a communication channel of the patient's record. But if the record from the CM practitioner is made on Chinese medicine terms, what can a Western medicine practitioner do about that? And if the Western medicine practitioner said that there's information, well, what would the Chinese medicine practitioner do about that? Is it the same as the concept of information in Chinese medicine? And also, if there's collaboration, what about the professional indemnity insurance for negligence? Well, I'm not talking about these problems which should be tackled fresh from the ground. But if we look at the practice in the mainland on Chinese Western medicine collaboration, and they have a wealth of experience, and we can just refer to those experiences. They are available for our adaptation and application. And standardization of Chinese herbal medicine. In 2017, a scholar has found out that in Hong Kong, there are loopholes in regulating tonic substances. For example, for the traditional An Gong Liu Huang, one is for acute treatment, not for the health promotion. But in Hong Kong, it was registered as a kind of tonic food. And also for the prepared form descriptions and relevant standards are already there in the mainland, and we can use them. They are readily available, and we have pharmaceutical companies with proprietary medicine manufactured in Hong Kong. We should make use of their expertise, and we also do our best to protect our heritage, because you know that Japan and Korea are our competitors in this field of Chinese medicine.
Dr. So Chang-wing. Mr. Ban Chen. Thank you, President. I thank Professor Wing-kwong. He is also a Chinese medicine practitioner for moving today's motion. On promotion of the development of CM, I thank Professor and Dr. Wing-kwong for supporting the development of CM in the past 10 years. So even without a representative from the CM trade, the CM sector could develop vibrantly. Now today, he is among us, and he is moving this motion today. So I think it is a good opportunity for us to discuss how we can transform the development of CM. Now the government's policies would decide the flow of talent. Now, at present, collaboration between Chinese and Western medicine is limited. Now, the ICWM program only covers stroke care, musculoskeletal pain, and cancer palliative care. Now, it is only under the epidemic when we have ICWM on programs like upper respiratory symptoms. Now, the major function of CM is on preventive care. ICWM may have an imbalanced role for CM, and also remuneration package for CM and Western medicine practitioners are very different. It is very difficult to attract young blood into the trade. Now, if this persists, it will undermine the development of CM in the public sector. As at June 2022, there are some 800 registered CM practitioners, 27 practitioners with limited registration, and some 2,000 listed CM practitioners. Now, they would have undergone 6 years education with 5 years on campus and 1 year in internship. Now, they have spent a lot of time on training themselves to become CM practitioners, looking to treat people, but the remuneration is really discouraging. Now, the treatment, the remuneration package is very different from that of the Western medicine students who have undergone the same years of training. Now, compared with Western medicine, CM practitioners' salary is very low, and there is no standardized pay scale for CM practitioners in the public sector. Now, their progression pathway is very unattractive, even more unattractive than that of the nurses. Now, on entry level, the salary is $24,000 to $27,000 for CM practitioners, some 10% lower than nurses in the public hospitals, in the public sector. Now, compared with the entry level of $70,000 for doctors, it is really meager. Now, and there is very limited room for employment. Now, when CM CTRs start recruitment, there would be a lot of people vying to get the offer. Now, public hospitals would take on graduates from CM schools. However, they would be employed on contract terms, and there is very little prospects for them. Now, that's the objective situation. Now, after all the years of training, the leaving of the industry would cause serious damage to the development of the sector. Now, of course, in Hong Kong, CM developments in the public sector lags far behind that of Western medicine. Now, for CM clinics, the charge level are not unified. Chinese medicine consultation fees is 2.4 times higher than that of Western medicine. So some demands have been suppressed because of the high charge. Now, we should elevate the status of Chinese medicine in the public healthcare system. Say, for example, at HA board, maybe we should have board members from the CM background. And also, in terms of medical planning, we should be more proactive in gauging views from the CM stakeholders. Now, there is a lot to say about this topic, but 5 minutes is too short. I can only thank Professor Chan for his motion. I will also support the amendments. Thank you. Mr. Brave Chan. Thank you, President. I also thank the Secretary for being here. I speak in support of Professor Chan's motion on actively promoting the development of CM to alleviate the pressure on the healthcare system. Many members have spoken. The contents of the suggestions are rich. Now, having experienced the 3-year epidemic, I think most of us have experienced firsthand the effect of Chinese medicine. Now, we could attend CM consultation at home through telemedicine and had CM drugs delivered to our homes, so it is really good. Now, according to the reports of the 20th National Party Congress, now the national strategy is to enhance the usage of CM and also establish a mechanism for CM development. And also, when President Xi visited Henan, that is the birthplace of CM, he said CM has a 1,000-year-long history of saving lives. That's true. So we should combine CM into our public healthcare system. Now, like Dr. Tao Yaoyao, he is a Nobel Award laureate, and he has helped gaining recognition for CM in the world, and he has saved a lot of lives. Now, when dealing with SARS and also COVID and other major diseases, President Xi said it allowed us to gain more insight in the usage of CM. And the future pathway must be one combining the strengths of CM and Western medicine. Now, we recognize the authority and the effectiveness of Western medicine. That's fine. But if you ask the general public when they attend the ANED, when resuscitation is required, of course, Western medicine is the way to go. However, for chronic diseases and other preventive cares, CM can play an important role and triage patients away from ANE. Now, if you join the queue and wait to see a doctor at public hospitals, you may have to wait for several months because of the manpower shortage, and you can only get a few minutes per attendance. Now, people are in tears when they tell us the queue going to the Heavenly Kingdom is shorter than the queue at public hospitals. So we have to really think about how we can give appropriate care and help to patients in need. ICWM is the way to go. Now, we have a very serious manpower shortage in the Western medicine sector. It has been widely discussed in the Council. So we have to act swiftly. Now, chronic disease and also short-term and long-term treatment plans, we should combine the wisdom of both Chinese and Western medicine. Now, there were lots of controversies. However, after SARS and after COVID-19, we have received help from CM practitioners from the country and from Guangdong province. And CM has gained a lot more recognition locally. So we should pick a pace in formulating a development blueprint for CM in Hong Kong. Professor Chen also mentioned that ICWM can make full use of technology, and we can learn from the ICWM model in the mainland. This will help us benefit the civilization as a whole and also people's health in Hong Kong. Thank you. Dr. Priscilla Leung. President, I speak in support of Professor Chan Wing-kwong's motion. Now, development of traditional medicine is the national strategy of our country. Now, if you look at Article 21 of the Constitution of the country, it stipulates that we have to promote the traditional medicine of country to encourage the development of fine CM practitioners in urban and rural areas. Now, Article 138 of the Basic Law mentions that the government must formulate policies to develop Western and traditional Chinese medicine to improve medical and health services. Now, this is a duty of the government under the Basic Law. Now, when visiting Zhuhai, President Xi said we have to explore deeply the essence of the treasure trove that is Chinese medicine. We have to promote tripartite collaboration and promote modernization of CM and promote CM to the world. Now, I have been a staunch supporter of Chinese medicine since 1992. Well, to be honest, I have a lot of minor diseases, and I found that CM could treat my problems as the roots. Now, and also in terms of policy application, I've always been urging for ICWM and also the recognition of CM. in Hong Kong. Now, when I first entered the council in 2008, my first verbal question was when we will have the CM hospital. Now, we will have the hospital in year 2025. So last year and also the year before last, during the pandemic, the efficacy of CM has been recognized. It is most useful in preventive care and also treating COVID at the root. Now, to gain real recognition of traditional Chinese medicine in the world and by the Western medicine sector generally, we can't just rely on policy. Now, besides legislation, besides articles on CM legislation, I've also written an article on the history of CM. Now, some 2,450 years ago, Athens in Greece combated a disease which aligns with the TCM philosophy. Now, Socrates and also Plato, in their days, there was a huge plague. Now, according to the history book, there was a doctor who gave a speech in Athens. Now, he said we should disinfect the plague areas with fire, and also that we should adopt some natural course of treatments, including more sleep and also healthy diet. So I think ancient people share the same philosophies in TCM. Now, TCM is a caricature of the essence of our culture. Now, in 221 BC, we had isolation plans for infectious disease. And also, in TCM, we had an isolation policy. In the Tang Dynasty, there was an isolation plan to isolate patients with leprosy. And also, in traditional Chinese medicine wisdom, there are lots of CM practitioners advocating for isolation of patients and also treating patients with plans which align with modern treatments. Now, I have a friend which sells traditional Chinese medicine products combined with natural supplements, and it is very popular. So I think TCM has a lot of interplay with modern treatments. Now, we have never abandoned research on TCM. So the country is doing a very good job at ICWM. Thank you, Associate.
Mr. Vincent Chang. President, first, I thank Professor Chen Wing-kwong for his motion. That gives us an opportunity to share our thoughts on local CM development. I support the motion, including the idea about developing public sector CM services and also strengthening the training of CM talent and all these measures. President, CM is a great asset of Chinese culture. It's a key component of our culture. CM has always been used for wellness and prevention of diseases. In the past, especially during the COVID years, CM played a key role in treatment and rehabilitation. People get an ailment, they go to a CM practitioner, or they can go to a CM clinic to seek treatment. During COVID, many people turned to CM practitioners. They took Chinese medicine to deal with long COVID. In Kowloon West, there's Kwong Wah Hospital. It works with non-government organizations. They provide CM specialist care. Now, let's look at the figures. For outpatient clinics, there are more than 14,000 visits every month. That's more than 1,000 people turning to the clinics. And they're comparable to the visits to Kwong Wah Hospital. So there is keen demand for CM services. Hong Kong has already been helping the development of CM. There's an integrated Chinese Western medicine pilot scheme across different districts. There are Chinese medicine clinics in 2014. The plan was first proposed for a CM hospital in Chun-keung. But the public sector CM services are very limited right now. There are only 43 public hospitals, and only 8 of them take part in the scheme, and it only covers certain conditions like stroke, cancer palliative care, musculoskeletal pain management, etc. Now for Kowloon Hospital, it treats lower limb pain. In Kowloon West, there are 2 CM clinics, Queen Elizabeth Hospital and also the Cheung Sha Wan government offices. But they only provide some services like Tuina, acupuncture, and also bone setting, etc. The growing demand for CM services and the aging population, and also the growing pressure on the healthcare system, mean that the government should listen to members' views and provide more public sector CM services. Here are my suggestions. As many members have suggested, we need to expand the scope of the ICWM. That way, more public hospitals can take part in the scheme. We need the scheme to cover more diseases so that more people can access CM inpatient services. At public hospitals, we need CM units. We should also set up regular posts for CM practitioners to tie in with long-term CM development. We have more than 10,000 CM practitioners, 8,000 registered them, but less than 10% of them work in the public healthcare system. The government needs to make good use of CM practitioners, give them a clear pay scale, progression ladder, let them take part in the work of public hospitals. That way, we can see better collaboration between CM practitioners and their Western medicine practitioners. And we also need to incorporate CM practitioners into our primary healthcare blueprint. Now, there's a blueprint that came out in this current term government. The focus is on prevention, and this focus is on prevention, the community, families. This means CM has a role to play. And this is in line with the development plan for CM. So CM practitioners can work like family doctors. They provide help to patients. So at district health centers, there's room for CM to play a bigger role. Many members have made good points. The government needs to show resolve, listen to the views, and to take action to promote CM development, make CM an option available to the public, and ease the pressure on our healthcare system. President, I support the motion and the amendment. I so submit. Mr. Edmund Wong. Madam Deputy, a CM is a great asset of our country. For thousands of years, CM saved lives. And for its thousands of years of history, CM played a key role. Over the past 3 years of COVID, 莲花清瘟, capsules, 金花清感, granules, these are the proprietary Chinese medicine that helped fight COVID. They played a key role. Now, CM is about strengthening the body. It's also about maintaining wellness. It helped in treating COVID and long COVID and also managing chronic illnesses. CM worked particularly well. I'm taking CM myself. Now, Hong Kong has been promoting CM development. This is more than just about a new industry, but also about protecting people's health and addressing the aging population and also the pressure that comes out of it. CM can play a part in easing the pressure. On this note, I thank Professor Wing-kwong for moving this motion so that we can have a discussion at the LegCo to look for ways to better promote CM development in Hong Kong. Now, for any industry's development, we need talent. We need enough talent for the industry to keep going in healthy development. The CM is no exception. Now, for Hong Kong CM development and talent training, the Hong Kong Baptist University has been training many CM talent and made great contributions. The HKBU started its bachelor's degree in CM as early as 1998. It was the first university in Hong Kong to offer bachelor's degree program. Professor Wing-kwong is a graduate of HKBU's CM school. I'm an accountant, so let me share some figures. I said June last year in Hong Kong, we had 8,075 registered CM practitioners. For registered Western medicine practitioners, 15,298. So CM practitioners make up roughly half of Western medicine practitioners, but we don't have a specialization system for CM practitioners. So that has a bearing on people's trust in CM practitioners as professionals. That also stifles development and also restricts opportunities for the continuous development of CM practitioners. All these hold back CM development. Back when we were little, our parents would get the herbal remedies and we do the decoction ourselves. Now things have changed. Now they have carbon tablets. So that takes professional training. Proprietary Chinese medicine takes development, research and development. And for that, we need CM pharmacists to do the research. But we lack a statutory registration mechanism of CM pharmacists. So that for CM pharmacists and their work, there has yet to be any recognition. Again, that holds back the development of CM and CM pharmacists, and that does nothing to help attract talent. So I hope the government can set up a registration system, a statutory registration and specialization mechanism for CM pharmacists. That way, we can raise the professional profile of CM and CM practitioners so that more people can join the industry and promote the comprehensive development of CM in Hong Kong and for CM to be part of our public healthcare system. I so submit I support Professor Chan's motion and the amendment. Mr. Chen Xiu-hong. Madam Deputy, I speak in support of Professor Chan's motion on actively promoting the development of CM to alleviate the pressure on the healthcare system, and also the amendment. CM has a long history. Many people in Hong Kong turn to not just Western medicine practitioners. After they get well, people turn to CM practitioners for rehabilitatory wealth maintenance. In 2021, 1.28 million people turned to CM clinics. That's a 16% rise from the 1.1 million some years ago. Seniors also spend their medical vouchers at CM clinics. It went from $142 million to $798 million over the years. This shows there's growing demand among seniors for CM services. After people get well, people turn to CM. This is even more common during COVID years because CM works in treating long COVID. With long COVID symptoms, people turn to CM practitioners for health maintenance. In 2020, across the 18 districts of CM Clinic cum Teaching and Research Center, there are special outpatient clinic services offering CM services for COVID patients who have recovered but suffer from long COVID symptoms. There were up to 10 free internal medicine CM services for these people. As at the end of January 2023, across the CM clinics, more than 100,000 recovered COVID patients have received care, and that involved 440,000 consultations. Now, given the limited quotas, some recovered COVID patients failed to book a slot for these special outpatient clinics. Now, COVID started, and there were some years have passed. We have seen more than 2 million positive cases. Now, for the special day outpatient care services, they failed to meet all the needs. So many people turn to CM practitioners in private practice. We have an aging population, and people are willing to receive CM care and CM works in treatment. The government should step up the development of CM for CM development. As a part of our primary healthcare system. They can play a role. They can provide preventive care and then also help take pressure off the specialist and also inpatient services of our public healthcare system. Last year in the policy address, the government proposed more government-subsidized CM services at outpatient clinics to up to 800,000 places. Now, but that falls far short of the number of visits people actually make to the CM clinics. Even in our public healthcare system, if we can do integrated Chinese and Western medicine services and the inter-referral systems, that will help take pressure off the system. Now we have the ICWM pilot scheme. You have CM practitioners. They work with doctors. For eligible patients, there are care for stroke, cancer, and also musculoskeletal pain. The scheme has a good target, but then only 8 hospitals offer care for just 3 conditions, and there are 7 clusters of hospitals in total, so there are limits. We need to expand this ICWM scheme so that more conditions are covered. Let CM play a bigger role in treatment. Madam Deputy, there are constraints under the law. CM practitioners cannot make use of diagnostic imaging or testing that holds back CM practitioners. So I suggest that the government should speed up the review and also amend the relevant statute. Let CM practitioners refer patients to do imaging and lab testing so that CM can refer patients to like orthopedic x-rays or magnetic resonance imaging for health checks. We also need a professional structure framework and also pay scale for CM practitioners. In promoting CM development, the government should also set up a pay scale and also a career path promotion ladder so that for the CM clinics funded by the government and run by NGOs can follow the same standards. Varying standards stifle the development. As at the data from last November, we have more than 8,600 registered practitioners, 2,000 scheduled practitioners, and 27 limited registered CM practitioners. We have a chronic labor crunch. We need to make good use of our existing CM practitioners, do public-private partnership, and allow CM practitioners to treat patients.
Mr. Chen Pui-leung, well, CM is becoming more and more popular in Hong Kong. It forms part of the healthcare system in Hong Kong. In the 5th wave of the epidemic, CM make contributions in rehabilitation and treatment. It also takes away part of the pressure faced by the public healthcare system, and people are getting more and more receptive of CM treatment. But at present, CM services are very limited. There are only 2 subsidized services. For example, going to the 18 clinic research centers, and also the ICWM covering cancer, muscular diseases, and so on. And these services are limited in scope and cannot meet the full needs or full demand for services. So many people would like to see further development of CM service. At present, services in the CM sector are mainly provided by private CM practitioners. There should be further measures to promote CM Western medicine collaboration. And the first CM hospital would be up and running in 2025. We should promote CM services so that patients can get treatment timely, and also we can alleviate the pressure faced by the public healthcare system. When I met the CE, I make a number of suggestions. Some of them have been taken on board in a positive manner. We have to promote the role played by CM in primary healthcare. We can start this by giving them a role in the district health centers, and the training should be promoted. the government has been devoting more resources on primary health care so that we can prevent diseases instead of curing them. CM has its unique advantages in prevention. And CM can also, at present, rehabilitation services are mainly carried out by Western medicine practitioners. We should allow CM to play a greater role. There are research pointing out that CM Western medicine collaborations will be more cost-effective in treating chronic diseases. So I hope in the ICWM pilot program there should be more collaboration between CM and Western medicine. Last year, some Chinese CM clinics, together with the district health centers, provide Tianjiu treatment for patients. And we would like to see patients getting suitable CM services in the district level so that there will be fewer incidents of diseases. The unique theories of CM are very much valued nowadays. Together with G19 members, we visited a lab on CM in Macau. We understand that one of their important mission is to provide standardization of Chinese herbal medicine. And they have promulgated a number of ISO standards. Hong Kong has an international platform for CM. We have a data bank on the standardization of Chinese medicine. We need to update that set of Hong Kong standards and the list of Chinese herbal medicine so that we can become a standardization and accreditation center for CM. Madam Deputy, with these remarks, I support Professor Chen Wing-kwong's original motion and other amendments. Mr. Robert Lee. Thank you, Madam Deputy. I support Professor Chen Wing-kwong's original motion and the three amendments moved by other members. Under the 14th five-year plan, Chinese medicine will be promoted. In 2019, under the strategy to promote a healthy country, a number of measures were launched to support CM, and the SAR government should tie in with the national policy and promote CM development in Hong Kong. And we should further promote CM Western medicine collaboration and the training of talent, and introduce a registration system for CM practitioners and improve their pay and welfare career prospects. Under the healthcare voucher system, from the spending has increased from 5.59 million to 8.5 million. That is from 126 times the higher. And from 2019, 23% to the present 33%. So that's the choice of more patient, a big number of patients. So there's an urgent need from the public. The government should expand the coverage of CM Western medicine collaboration medicine treatment program, so as to improve the efficacy of treatment and also to promote CM development and specialization of CM. There should be a specialization registration system similar to Western medicine practitioners. More subsidies should be provided to CM clinics to improve the quality of service. And there should be more subsidy for the professionalization and training of CM practitioners. And through publicity, people should be educated to understand what CM is about and increase their confidence in CM. Through such subsidies and measures, CM will be modernized and more scientifically proven. And CM is very effective in treating chronic diseases. Through our duty trip to Macau, we have gained a better understanding of CM. We should collaborate with GBA cities and also establish a leading national lab on CM to promote standardization and accreditation. We should cooperate with Guangdong and set up a CM production base in Hengqin. The administration should promote the exchanges between our higher education institution with Auburn and CM sector there. Professional training can increase the efficacy of CM treatment. Lastly, I support the introduction of the pay scale and the promotion system for CM practitioners. The administration should make reference to the pay scales of Western medicine practitioners and nurses in setting the pay scales of CM practitioners in the Chinese medicine clinics so that we can retain them and provide more subsidized services to patients. With these remarks, I support the motion. Professor Lau Chi-Pang. I would like to thank Professor Chun-keung for moving his motion and for other members who have moved amendments. After the positioning of CM in Hong Kong in 2018 by the administration, we have been seeing some developments. There will be the first Chinese medicine hospitals. There will be subsidized outpatient and hospitalization services, and there will be an R&D center to promote exchanges and to improve clinical treatment. And there will be a network of CM clinics providing services to patients. Well, the motion talks about the relevance of CM to an aging population. This is a very valid point. Well, CM is the cultural heritage of our thousands of years of history. We have 18 CM clinics. Starting from 2020, they have been providing outpatient services through subsidies from the government, providing a variety of CM services to patients. According to a recent survey, some 1,700 respondents, half of them were interviewed, half of them would like to see further collaboration between Chinese medicine and Western medicine. But they were not aware of the 18 district CM clinics. It seems that the message is not reaching wide in the community. We have only 8 public hospitals participating in the ICWM pilot program. And the diseases covered by the pilot program are limited. CM is more costly than Western medicine, so many patients would opt for subsidized Western medicine services. But we need to allow CM and Western medicines to complement one another. So the pilot program and the cooperation should extend the coverage of diseases and lower the consultation fees. And it should be further considered that in all public hospitals, there will be a CM section, so that through the CM section in the hospital, there will be integrated collaboration of CM and Western medicine in the hospital. We are facing a shortage of hospital manpower, but we have a surplus of CM practitioners. 90% of CM practitioners are working in the private sector. Only 100 or so are working for the public healthcare system. If we extend the hospitals, services in hospitals, we can resolve partly the manpower shortage. Whether we're talking about the SARS epidemic 20 years ago or the recent COVID, CM has played an important role in combating the epidemic. This time, through the epidemic, many people gained a better understanding of the importance of CM. So in the long term, the irresistible trend is to have more CM services. So we need to have CM sector representatives in the development of hospital services. All in all, CM services are good value for money and are effective. And also in terms of prevention and rehabilitation, CM is enjoying certain advantages. And in the fight against the epidemic recently, the efficacy has been further proved. The government should devote more resources to develop the CM and also to widen the application of CM services so that we can provide people's health and alleviate the pressure faced by the healthcare system and to ensure fair distribution of resources in the system. With these remarks, I support the original motion and the other amendments.
Professor William Wong. Thank you, Madam Deputy. In recent years, the government has been promoting the idea of primary healthcare. The primary healthcare blueprint promulgated last year focus on preventive care rather than reactive treatment. Now, it will strengthen the public healthcare system's resilience and also shorten waiting time for patients. Patients can recover faster and enjoy better quality of life. Now, this philosophy dovetails with the philosophy of preventive care under CM. Now, the CM's philosophy is to preempt disease before they set on. So I support the motion of Professor Chan and the amendments. We should include CM, preventive care and rehabilitation elements in the 18 CMCTRs. And on the community level, the government should promote the usage of CM widely and encourage the public to use CM for preventive care purpose. Now, in the past, usually only older people would use CM. Now, it is trendy for young people as well. Now, to encourage the next generation to embrace CM, we have to promote CM to young people and students. Now, at a student health center, the services include a visual examination, a hearing examination, and so on. Now, CM components can be included in students' health service to expose students to CM. Now, in many city dwellers are too busy to visit clinics to treat the disease. Now, we should adopt technology to address this issue. Many CM practitioners are using telemedicine technology already. Now, I have been working with the stakeholders to provide telemedicine consultation of CM services to people in the neighborhood, and then the drugs would be delivered to the doorstep of the patients. Now, I support the government enhancing the usage of telemedicine consultation in CM. Now, technology is widely adopted by CM practitioners. Now, we already have an equipment to identify the physical condition of the patients according to CM principle. Is there a drought in the body, or is the body too humid? The equipment can tell you. Now, and also there are lots of equipment for testing the authenticity and the safety of CM drugs. And also we have genome testing to test the authenticity of Chinese medicine ingredients. And also, there are technology, there are high-tech, they are using blockchain to authenticate Chinese medicine products. Now, I support studying the application of technology on Chinese medicine development. Now, the blueprints also mentioned the government would enhance the application of CM in primary healthcare. I hope this can be realized swiftly. More CM practitioners will be able to benefit patients in the neighborhood. I support the motion and all the amendments. Mr. Dominic Lee. Thank you, Madam Deputy. Now, CM is proven to be effective in treating a lot of diseases in the world. Now, in many places, more and more people know about and accept CM. Now, during the fifth wave of the pandemic, CM's usage has seen great results in practice. Members of the public are confident in CM's functions in treating minor diseases and also in preventive care. And also CM is very important in terms of inheritance of our culture. It is a cultural treasure. So I thank Professor Chen for moving today's motion to promote development of CM, which gives us an opportunity to discuss this important issue and urge the government to take action. Now, to promote development of CM in Hong Kong, besides the invaluable views put forward by other members, I think our crucial role is to promote the internationalization of CM. Now, around the globe, CM is gaining more understanding among different countries. Now, recently, the French government has launched a regulatory and accreditation regime of CM in France, promoting the development of CM there. Now, we are the connector with the world for the country. So maybe we should establish an accreditation system for CM practitioners, not just applicable locally, but also the world. Now, this is the role we can play in terms of internationalizing CM. Now, to promote the development of CM, it is very important to enhance the remuneration for practitioners. However, people's mindsets are also very important. The acceptance of CM is crucial. Now, after the epidemic, more and more people agree that CM is useful for rehabilitating from COVID and also for treating chronic diseases. But I think it's still not enough. Many friends I know are still skeptical of the efficacy of CM. Now, the government has a role to play here by educating and educating people on the efficacy of CM. We can build trust. Now, in UCLA in the US, they are offering CM programs to teach students on the knowledge and application of CM. So besides enhancing public knowledge on CM, we also want a more industrialized CM industry. This is an important direction. Now, in Germany, in a state, the government of that state is actively promoting the CM industry locally. So I think we have much to learn from them. We should give full play to our inherent advantages. Now, if our suggestions are taken on board by the government, I think the CM sector can play an ever higher role in our public healthcare system, and Hong Kong people will be the ones to benefit. Thank you. Ms. Elizabeth Court, Madam Deputy, I speak in support of Professor Chan's motion on actively promoting the development of CM to alleviate the pressure on the healthcare system and also the amendments. President Xi emphasized that we have to speed up promoting the modernization and industrialization of CM and puts equal emphasis on Chinese and Western medicine and promotes the high-quality growth of both Chinese and Western medicine. Now, the report of the 20th National Party Congress mentioned that we have to promote the high-quality growth of CM in terms of dealing with public health emergencies and also infectious diseases. So here in Hong Kong, we should be more active in promoting development of CM in terms of legislation, talent nurturing, innovation, and also collaboration between Chinese and Western medicine. We should do all these to protect people's health. Now, Chinese medicine has a very long history. It is our treasure. And also under the epidemic, it has saved a lot of lives. In preventive care and also treating diseases, it has been widely recognized. But there are lots of bottlenecks in terms of the development of CM in Hong Kong. We need top-level planning for development of the industry, and all along we don't have a comprehensive ecosystem of ICWM. There are lots of hurdles in the collaboration between the two sectors, and the government is not attaching importance to training up CM talents. Now, if all these can be resolved, the trade can enjoy a more comprehensive growth, and also CM can help alleviate the huge pressure in public healthcare system. Now, there are many issues today. I will focus on establishing a progressional pathway for CM practitioners, establishing a salary framework, salary structure, and also providing more articulation pathways. Now, the DAB has been advocating for these. Many people would opt for CM services when they are sick, so the demand is high. Now, when I was diagnosed with COVID, I've been taking Chinese medication. However, the booking at the 18 CM CTRs are always full. We have many CM talents, but the fact is the salary level is so unattractive that CM practitioners will not join the public sector. Now, some CM students I know would not choose to join the trade after graduation because the pay is too low. So there is a shortage of supply. The private-public ratio is 1:9 for CM practitioners. The starting salary is much lower than other medical professions. Now, for CM CTRs on entry level, CM practitioners will have a salary of $24,000 to $27,000. Now, for nurses in the HA, the entry level salary is $30,000. For doctors, $64,000. So the Chinese medicine practitioners' salary point is lower than nurses and much lower than doctors. Now, the duration of training is the same, 6 years. However, the salary is very low for CM practitioners. After 6 years of study, their remuneration is lower than the other two professions. Now, with the commissioning of the CM hospital, the CM practitioners working there may have a salary lower than the nurses. That's very strange. And we don't have a registration system for CM practitioners. Now, we have universities offering CM-related programs, but we don't have the registration system for CM pharmacists, like Western medicine pharmacists. This undermines the recognition for CM practitioners, and it undermines the growth of talents. Now, to address these issues, the government must establish a salary structure and articulation pathway for CM practitioners and also a registration system for CM pharmacists. We also hope the government can continue to enhance ICWM and CM in the public sector, as well as inter-referral legislative framework between CM and other medical professions and train up more talents. Now, if we can achieve all these, the pressure on healthcare system can be alleviated and people's health will be better protected. Thank you. I so submit.
Dr. Junius Ho. Madam Deputy, I support Professor Chan Wing-kwong's motion. I agree. This is about actively promoting the development of CM to alleviate the pressure on the healthcare system. We want to bring CM into our healthcare system to ease the pressure on the system. That's right. For thousands of years in Chinese culture, we've had Chinese medicine before penicillin became a thing. So this is about preserving our culture. There are 1.4 billion people in China. So the value of CM is obvious. Practice is better than theory. I support this motion. Now, before I address the point about incorporating CM into our public healthcare system, I want to make 2 points first. First, it has to do with Chinese materia medica. There was a 2021 monthly digest of statistics. Retailers of Chinese materia medica, 120 retailers, and 1,153 workers employed by such retailers of Chinese materia medica or Chinese drugs. Now, the remedies are cheap, maybe somewhere below $100. But these are something people can afford. So can we make use of the existing retail network, develop an application? So someone uses the app, set up a centralized system. The patient's health records, drug history, all on the centralized platform, and pay a small fee to these sellers of Chinese medicinal drugs. That's how you address a bread and butter issue, and you can see immediate effect. Now, the subsidy can be a separate issue, but we need something like this system. And we are really talking about scheduled CM practitioners. So this is for the drugs. Now, my second point, telemedicine. Teleconsultations. Back in 2022, COVID was raging. People were suffering. So many CM practitioners and bodies were already doing teleconsultations. That was a great idea. Please zoom in here. Now, this is about treating people. $30,000. 120 patients were treated, 3 doses of Chinese medicine, no decoction needed. It was proprietary Chinese medicine. Proprietary Chinese medicine, whatever herbal remedies there were, no decoction needed. People could just take the drugs. So that really cured the disease, and that benefited many staying in senior care homes for those with mobility impairment. $30,000 treating $120, so that's less than $80 per prescription. And that was a single formula Chinese proprietary medicine. If people can do in-person visits, the drugs will be even cheaper. In 2025, we will have the CM hospital. We already have the experience with CM. There are many NGOs working on CM services. Practice matters more than theory. So the only way to test the truth is practice. So I so submit. I have made these 2 points for the Secretary to consider. Let's work on this and deliver results. I so submit. Members, according to House rules, there's a time limit. We have to wrap up this debate at 11:30 a.m. At roughly 11 a.m., I will ask the mover to speak, and then I will deal with the remaining matters. Dr. So Chun-wing. Madam Deputy, now it's necessary to promote CM development here. We have the geographical advantage. People welcome CM, and CM has a proven track record. CM can also help take pressure off our healthcare system, and there's a pressing need. Article 138 of the Basic Law sets out clearly that we can make our policies for the future development of CM. But then 20 years have lapsed since the handover. Little progress has been made. Look at the World Health Organization. In 2012, there was a strategy for conventional medicine 2014 to 2023 that covered training on traditional medicine, and there's keen demand for such training. So can Hong Kong do better? In the CM sector, Professor Wing-kwong is a representative figure. He's now a lecturer member, and he has raised this profound subject. And this is also a sign that we are taking a step forward. I support the motion and the amendment. To promote CM development, the government has a role to play. We need better regulations, a better system, better training, employment support. All these are for the government to act on. Now, the government policy will determine the success or failure of a development. CM has proved to be effective. More people are turning to CM and they trust CM. As at the end of February this year, there were 10,757 CM practitioners. 8,294 were registered CM practitioners. CM-related professional services or resources are already there. This shows we have the favorable conditions for CM development. So there's a need for more support, and there needs to be recognition for professional qualifications. And there's also a need to incorporate CM into the public healthcare system and also into the primary healthcare system. All these will have a bearing on raising the professional profile of CM services. And doing that will also help ease the pressure on our public healthcare system. Madam Deputy, I suggest that we need to act more quickly in these areas. First, the government should take the primary responsibility to improve the CM development blueprint right away. For the profile for CM, the industry systems, the training programs, etc., there needs to be a comprehensive plan. That way, we can build up a well-developed system, an entire ecosystem of CM development in the community. The work will take more than the effort of the CM sector. This will also require government support and more resources. There's also a need to improve the CM management system. We need something like a CM authority to take the lead in developing the CM sector. At public hospitals, we need to institutionalize the integrated Chinese and Western medicine treatment and also patient referral system, so that CM practitioners can play a role in patient referral. And we also need to strengthen the role of the district health centers across districts. On health checks, consultations, CM services need to become part of the public healthcare system. And for universities, there's a need to strengthen the training programs. There's also a need to improve the promotion ladder. We need a pay scale for CM practitioners. We need a career path to attract more talent to join the CM sector. We also need to promote a mutual recognition system of CM qualifications in the GBA and create a better career prospect for the CM sector. Mr. Benson, look. Thank you, Madam Deputy. I thank Professor Chen Wing-kwong for moving this motion and also the amendments from 3 members. The recent years have seen CM playing a more important role. In the 5th wave of COVID, the CM sector played a crucial role. Let's look at Article 138 of the Basic Law. It says that the HKSL government can formulate its own policy on CM development and also promote the development of healthcare services. This shows that the development of CM has a role to play as enshrined in the Basic Law. Professor Chen Wing-kwong being elected as a legislative member is also the acknowledgement of the CM sector. Now, in the outline development plan of the GBA and also the construction plan for the Chinese Medicine Highlands in the GBA 2020 to 2025, they show the importance attached by our country to CM sector. Now, we need to take our country's CM development as the basis for our future development. We need to build up an industry chain of CM development, and that should be part of our long-term strategy. In last year's policy address, paragraph 85, it's proposed that the government will further promote CM development and also draw up a CM development blueprint. There will be a post of Commissioner for CM development. It will be regularized, integrated Chinese and Western medicine treatment. And steps will be taken to deepen the collaboration of CM in the entire GBA. In planning and setting the goals, the government is taking the right steps, and this is also tying in with our country's directions, and this should be acknowledged. The policy address proposes a commissioner for CM development. I hope this commissioner can bring together the government and the CM sector. This officer should also take the lead in policymaking on CM. One key area is to take forward the CM development blueprint. I hope this commissioner can work with the GBA in terms of formulating and implementing collaboration agreement. I hope this commissioner can continue to take forward education and publicity on CM for the public. So there are many duties lining up for the commissioner. Now, I know the government has probably a pool of candidates. The government should crack on with selecting someone. This has to be someone with stature, well respected, to take the job. The Secretary for Health should also keep the public updated on the development. The first Chinese medicine hospital will open in phases in 2025. This hospital will be a key part in promoting CM development. So we will need the manpower. Apart from qualified CM practitioners, we need other people too. We need other kinds of CM healthcare professionals, such as CM nurses, CM pharmacists. Now, some bodies organize short-term CM care programs, but there's something else we should do. For CM professionals, we need training and recognition for their professional qualifications. That's how we can develop an entire industry chain of CM. Doing that, we also let young people have confidence to take part in the CM sector and give them an incentive to take part in the process. And this will also help CM go global. I hope our government can take full advantage of our country's support, identify more opportunities in the GBA, work with the CM institutes in the GBA so that we can share our experiences and complement one another in our resources and pull out talent, let our CM practitioners go on attachment opportunities in the GBA and leverage our internationalized advantages and help our CM practitioners go global. I so submit.
Dr. Dennis Lam, Madam Deputy, President Xi Jinping said in his report to the 20th National Congress, saying that promoting Chinese medicine and improving the public healthcare system should be something that the country strive for. So the national plan would include the promoting and invigorating the development of CM as part of the National Revival Program. We're now in the post-COVID era. In fighting the COVID epidemic, CM played an important role. In the international arena, a lot of attention have been drawn to this development. We should seize the opportunity and project the development of CM internationally and explore and leverage on its great potential and make new contributions to the general well-being of the world. Since there's a growing pressure on our public healthcare system in terms of manpower, so I support the development of CM, Western medicine collaboration, and the nurturing of talent in CM, so as to alleviate the pressure on our public healthcare system. In the field of collaboration, we should leverage on our advantages because of the one country, two system arrangement. We can be the gateway for global development, and in the development of CM, we have a unique role to play. First, Hong Kong should become the place where CM standards are set, so that we can provide the tool to break the technical obstacles for CM medicine development. We can use the standards in ISO and other national standards to standardize the CM herbal medicine standards. And we can invite scholars and R&D experts to come to Hong Kong and promote our CM hospitals and higher education institutions to set up a research team with an overlooking perspective. We should seize the long-lasting effect of the successful story of CM helping to treat patients in the COVID-19 epidemic. We should launch a multidisciplinary research collaboration so as to provide a more solid scientific base for CM research and development. We can help mainland enterprises to explore overseas markets. Many CM pharmaceutical products are registered in Hong Kong, and because of the endorsement of the Hong Kong SAR government, that they are more internationally recognized. Lastly, we should encourage local CM manufacturers to go to the mainland, and the National Authority for CM has announced a streamlined procedure for application from Hong Kong CM pharmaceutical manufacturers. So for those who have been registered for the externally applied CM medicine for 5 years, will enjoy the streamlined procedures for the purpose of again accessing the mainland market. These will provide very good foundation and treatment for Hong Kong CM pharmaceutical manufacturers, and so that we can fully integrate it with the national program to develop CM and promote the internationalization of CM in Hong Kong. I support the motion moved by Professor Chun-keung and amendment moved by Ms. Hoi-yan, Ms. Joephy Chan, and Mr. Lee Chun-keung. The last member to speak in this motion, Dr. Hoi Simon Lee. Well, I would like to support Professor Chun-keung's motion and the amendments moved by the other members. Many members have talked about how we may promote CM. So I would venture to do a summary of what we are talking about. So we are basically saying that we should leverage on our status as a free port and also the rich tradition of CM in Hong Kong, so that we can become a trading center for both mainland and Hong Kong stakeholders. So we will be talking about R&D and treatment and manufacturing, and the integration of these players, so that we can facilitate the heritage of CM. Well, in recent years, especially after the COVID-19, the efficacy has been well recognized, and they have attracted the attention of medical personnel around the world. In many places, they would like to become the authority for the standards set for Chinese medicine. If you go to London, there's a Kew Garden with many Chinese herbal medicine there, and they would like to come up with a pharmacopoeia for CM there. Apart from Europe and also in Japan, the CM is very popular. So globally speaking, they are paying more and more attention. People are paying more and more attention to CM and Chinese herbal medicines. But this is a legacy of our ancestors, and we will have failed our ancestors if we do not give it fresh impetus and carry on with the tradition. And development of CM will also benefit the health care of our population. And the CM manufacturing as an industry will also make it more popular among the general population. The major difficulty faced by CM is, first of all, the qualification of CM practitioners. This is being improved and become more and more established. We have the assessment and the university courses for the training of CM practitioners. Secondly, using CM herbal medicine is also problematic. Even we are talking about the same herb, as different herbal medicine at different times of the year, and if they are harvested from different places, the quality differs. So it's very difficult for the testers and practitioners to ensure the quality of the Chinese herbal medicine. As a result, the cost of production is higher. If we can leverage on our advantages in Hong Kong in doing the testing and standardization so as to establish standards for different qualities, and the standardization of Chinese herbal medicines and materials will also, in a way, promote confidence. So, Professor Chan's motion on promoting the Chinese medicine is a subject that we should also talk about the advantages of Hong Kong in the promotion of the entire supply chain of Chinese medicine and services, so to promote the development of the overall CM. Professor Chun-keung, you may now speak on the amendments. I would like to thank Mr. Hoi-yan, Mr. Joephy Chan, and Mr. Lee Chun-keung for moving the amendments. Their amendments augment my motion. Mr. Chan asked for the development of primary health care by the government. Well, the Chinese medicine is more about prevention and the treatment of chronic diseases and pain. They have been proved. CM has been proved to be effective for treating such diseases, and the CM would certainly help relieve pressure on the public healthcare system. In the government blueprint, it said by the government that the CM practitioner will play a greater role in the public healthcare system. I hope more concrete measures and timetable will be promulgated by the government so as to specify the CM practitioners in the public healthcare system, and greater role can be played by them. And I also support Mr. Joephy Chan's motion in various aspects. But of course, although I do not object to the tripartite cooperation system, although this is not a bad idea, but this would limit the role played by CM practitioner. At present, the clinics training and research centers, apart from providing clinical services, will also be providing the collection of data collection and training functions. The three universities should providing support to this HA-operated facility. I think the government should look at this tripartite mechanism, and consideration should be given to turning this into a government-operated facility. In the long run, there should be CM clinics in all the 18 districts providing outpatient services to the general public, so as to illustrate the determination of the administration. As for Mr. Lee Chun-keung's suggestions of strengthening the integrated Chinese Western medicine plan, well, there's a development by the country on the information and digitization reform of the CM to promote the upgrading of CM. But Hong Kong has been moving rather slowly in this regard, where more than 8,000 registered CM practitioners. In an earlier reply to my question, as at March this year, for only 600 or so has registered for the e-health system. It is a small minority of the total number. And the e-health system usually contains the data collected by Western medicine practitioners. And now it has covered CM practitioners' medical records. With the consent of the patient, we can access the clinical information of the patient in respect of CM treatment and not the Western medicine treatment data. This would certainly hinder the services provided by CM practitioners. I hope the government would promote the digitization of CM medical record, and also to allow CM practitioners to access the medical records kept by Western medicine practitioners so as to further promote CM. With this remark, I support the 3 amendments.
Secretary for Health. Presidents and members, once again, I thank Professor Chan for moving this motion and the 3 members for their amendments. And also, 42 members have spoken during the motion debate. Their views cover a wide scope of issues, covering topics in relation to CM development, including service development, professional development, talent nurturing, and so on. It shows the importance of CM development in the public's mind. It also shows that the suggestions made by members are dovetailing the government's policy. Now, I want to emphasize one thing. Now, as the Secretary for Health, I want to emphasize that in promoting professional development in the medical trade, we would focus on professionality. We would focus on the health of patients, the safety of patients, and also quality of service. Now, if the development of the medical profession can ensure patients' safety while industrializing the trade and bring about economic benefits, we would pursue it strenuously. But the first priority is professionality rather than industrialization and commercialization. Now, before I address members' views and proposals, allow me to analyze our present situation in the public healthcare system. Now, we have several tiers of healthcare. Now, we have primary healthcare and second and third tier. Now, for primary healthcare, it is mainly for treating minor illnesses. Now, when there are any health issues, this is the first contact point for the public. The second and the third tiers are for treating more complicated cases, usually involving hospitalization. Now, at present, the HA is responsible for the Western medicine treatment as second and third tier. Now, for primary healthcare, in terms of Western medicine, we rely on clinics in the public sector, some of which are subsidized by the government. In terms of CM, at present, there are more than 10,000 CM practitioners. Most of them are serving in the private sector, and they are mostly running their service in the form of clinics. Now, so most of them are offering primary healthcare services. So far, we don't have a CM hospital yet. Now, later on, I will touch upon the role to be played by the CM hospital in 2025. Now, so how can we utilize the CM, the 10,000 strong CM force on providing primary healthcare services? Now, we have very little inpatient CM services as of yet. So, on whether we can offer this kind of service, we have to think about the CM manpower supply on providing second and third tier healthcare services. Now, the government offers support in the form of subsidized service quotas of CM services in the CM CTRs. Now, we are increasing the quota from 600,000 to 800,000 by the end of this year. Now, so among the quota, the subsidized ratio ranges from 60 to 80%. Now, for each attendance, the $120 paid by the patients covered the consultation fee and the medication. So it is a 60% subsidy. Now, for people above the age of 75 and also CSSA recipients, they will receive a full exemption. In other words, the consultation fee is 100% subsidized, and there is unlimited quota for subsidies. Now, for recipients of old age living allowance, they would receive a full exemption of charge without quota limits. Now, in year 2023 to 24, the funding allocation from the government to the HA on this regard reached $350 million. Now, we also have the elderly healthcare voucher scheme. Now, 4,000 CM practitioners have registered under the scheme. Now, there are 10 medical professions covered by the healthcare voucher scheme, and CM practitioners' number is the highest among the covered professions. And also, the funding application for CM ranks the second highest among the 10 medical professions. It amounts to $880 million, and there are 1.65 million attendances covered by the scheme. So besides increasing the service quota as the 18 CMCTRs to 800,000, we are also subsidizing some 2.45 million people through the healthcare voucher scheme. with a total funding amount of $1.2 billion. So that's outpatient service. Now, some members also mentioned our CM inpatient services. As I said, 10,000 CM practitioners are mainly offering outpatient services. On the development of inpatient CM services, the first CM hospital will be commissioned in phases starting 2025. Now it marks the migration of CM services from primary healthcare to the second and third tier healthcare. Now, by that time, there will be service delivery in terms of pure Chinese medicine, CM playing the predominant role, and ICWM. There will also be specialized services items and special disease programs covering gynecology, acupuncture, pediatrics, internal medicine, and so on. So in our future inpatient CM services, its developments will rely on the CM hospital. On professional developments, now we have to let the medical profession to take lead in developing the profession rather than just relying on the government. Now, in terms of interconnectivity of health record and also referral mechanism, we have to trust the professions. Now, at a suitable juncture, the government would offer administrative and legislative support. Now, in terms of specialization of CM, allow me to share the experience in the Western medicine sector. Now, it took a long time for Western medicine to become a specialized profession, and it was not led by the government. Now, it has been developed over the past century. Now, say for example, general medicine. At the beginning, the development of the trade is like a butcher. There was not such a recognized profession, and also gynecology and orthopedics were one trade. Now, when the skill set has become sophisticated, and when there were mature code of professional conducts and guidelines, the discipline was split into gynecology, pediatrician, orthopedics, and so on. And in sophisticated places, there are also sub-discipline, including brain discipline for children, and so on. So we have to allow the professions to develop a system for examination, training, and also qualification recognition. Now, the medical professions have to reach a consensus on all these. Now, under the Development Committee for CM, there is a CM subcommittee. It has made reference to the registration and training regime of Western medicine in Hong Kong, and also developments of CM professions in other places. Now, the experts and professionals in the three universities and also the Chinese Medicine Council in Hong Kong have established a task force on developing CM in Hong Kong. Their role is to advise the government on establishing a recognition mechanism for CM practitioners and pharmacists. Now, under the task force, there are three experts groups covering orthopedics, internal medicine, and also acupuncture. Now, the committee has held numerous meetings. When the proposals are ready, it will be submitted to the relevant bodies for discussion. So we rely on the efforts of the medical professions to reach a consensus and standardize the standard, and then at appropriate juncture, the government will support the trade in terms of administrative and legislative support. Now, under the Chinese Medicine Development Fund, we have a mechanism to offer support to programs to support the trade in reaching a consensus and establish a standing mechanism. Now, many members have mentioned that Chinese and Western medicines have their own strengths, and they are equally important. Now, we don't have to compare them apple to apple, and we don't want Western medicine doctors to govern CM practitioners, and we don't want CM practitioners to prescribe Western medicine. So we want to give full play to the edges we have on whether we should allow CM practitioners to refer patients for imaging services. Now, the initial legislative proposal is supported by the trade. However, for the details, we need an in-depth discussion among the medical professions, and also there should be a code of professional conduct, and we also have to consider the legal responsibility pertaining to the referral system. Now, on setting the code of professional conduct, the medical professionals must clearly understand the professional requirements and also the pertaining professional and legal responsibilities. Now, this is not just a power, this is also a responsibility. The power will come with responsibility. Now, the Hong Kong Institute of Chinese Medicine and the Hong Kong HAAM has held numerous meetings about the referral made by CM practitioners for imaging services, but the details are yet to be hammered out. Many members mentioned the remuneration packages for CM practitioners. Now, in different trades and different jobs, the remuneration level may not necessarily be linked with the years of training. Now, for an ordinary degree program, it is usually 4 years, but it doesn't mean that all university graduates will get the same pay upon graduation. So it depends on the academic attainments and qualification, the work nature and risk, and also the demand and supply in the market. In terms of remuneration for CM practitioners, as I've mentioned, most of them are serving in the private sector, mainly offering outpatient services. Now, the 18 CMCTRs have hired some 400 CM practitioners. The remuneration level and the terms of conditions are determined by the operating organizations. The pay level will be adjusted in accordance with the market situation and the service demand and supply. Now, concerning establishing a salary structure, we will have a discussion with the operating organizations. Now, the operating bodies would consider the remuneration of CM practitioners according to market factors. Now, with the improvements in professional standard and also the popularization of CM services, now, and also with the increase in complexity of services offered by the CM trade, we believe that the remuneration level would increase in general. Concerning mutual access of health records, starting July 2017, we have launched the second phase of e-health developments. Now, in the second phase, we have extended the mutual access of health record to Chinese medicine treatment record. Now, there is already mutual access of Chinese medicine treatments on the system. Now, the CM trade has their own healthcare record system, that is EC Connect. Now, this EC Connect is connected with eHealth and also CM clinics so that clinical CM records can be shared. By the end of 2022, the 18 CM CTRs and some 155 CM organization, CM institutions, and also some 400 CM practitioners have participated under the program, and 88 CM clinics have joined the EC Connect. Of course, the figure is not very encouraging. So like Professor Chen said, we want to achieve mutual access on Western medicine treatment record as well. So maybe Professor Chen can ask the trade why there is lukewarm response in participating in the eHealth Connect system. Is the trade attaching sufficient importance to the mutual access of health record? If that's the case, well, I think the systems will not be connected in the foreseeable future. So I hope Professor Chen can take the lead and encourage the participation and under the scheme, and also the digitalization of health record within the trade. Now, on collaboration with the mainland, the country attaches importance to the development of CM, and also there is the construction plan for the CM Highlands in GBA 2020-25. We have maintained a close liaison with the mainland departments and institutions. In March, I led a delegation to Beijing to visit the National Administration for TCM and the National Medical Products Administration. Now, there has been a lot of high-level delegations from the mainland visiting Hong Kong on how we can deepen collaboration on CM between the two places, including training up talents for the CM trade and also exchange programs. This will prepare for the commissioning of the third CM hospital. Now, the HA has made a lot of efforts in organizing high-level exchange programs. We have received CM scholars from the Guangdong province and help in training up CM talents in Hong Kong. We will also enhance collaboration on standard setting for scientific research and testing for CM pharmaceutical products. Now, we would make use of our Hong Kong Chinese Materia Medica standards to contribute to the Chinese pharmacopoeia. Now, with the upcoming government CM testing institute, it will enhance our testing capacity. Now, together with the Guangdong counterparts, we want to set a common standard for Chinese medicine for the Guangdong province. President, members, there are a wide range of issues discussed under today's motion debate. You can see that concerning the development of CM, it involves a lot of parties. Now, besides the Western and Chinese medicine trade, there are also other medical professions, the academia, the scientific research sector, the business sector, and society as a whole. Now, the issues we have discussed today are all interconnected, and they are quite complicated. Now, because of that, we have proposed the creation of the post of Commissioner for CM Development, and I thank the Legislative Council for approving our proposal. Now, this post must be held by a professional with CM background. Now, on the 12th of May this year, the Finance Committee has approved the creation of this post. I know everyone is very eager to see the post filled. Now, this is a high-level post, so we have to be prudent in the recruitment process, but I promise we will be prompt. Now, to promote long-term development of CM in Hong Kong, we have to sit down with the CM sector in formulating the development blueprints for CM. Now, we can't just write this development blueprint in silo. There must be a consultation process with the trade and different stakeholders in society. Only after canvassing the views can we come up with a comprehensive development blueprint. Now, with the coordination by the Commissioner for CM Development, we hope we will have this blueprint soon. Now, many members have given us a lot of invaluable views. We will make reference to all these views. We expect many of these issues will be covered during the formulation and consultation process of the Chinese Medicine Development Blueprint. Now, I have to stress that we have entered a new era for CM development in Hong Kong. We have reached a milestone. Now, we are not talking about recognition of CM by the Western medicine sector. We have to allow CM trade to establish standardization in terms of clinical guidelines under the principle of professional autonomy. Now, it is a challenge and it is also an opportunity. We have to seize our advantage in pure CM, and we have to inherit the wisdom and innovate and give play to our advantages in standard setting, service system, and regulatory regime, so that we can integrate into the developments of CM Highlands in the GBA and also the National CM Development Blueprint, so as to contribute to Hong Kong people and people in the country.
I now call upon Ms. Chen Hoi-yan to move an amendment. President, I move my amendment. President, I move my amendment. I propose the question to you that Honourable Chen Hoi-yan's amendment be passed. For those in favour, please raise your hand. Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the amendment passed. Honourable Joephy Chan, as Ms. Chen Hoi-yan's amendment has been passed, you may move your further amendment. President, I move my further amendment. I propose the question to you that Ms. Joephy Chan's further amendment be passed. For those in favour, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the amendment passed. Honourable Lee Chun-keung, as the amendments of Honourable Chen Hoi-yan and Honourable Joephy Chan have been passed, you may move your further amendment. President, I move my further amendment. I propose the question to you that Honourable Lee Chun-keung's further amendment be passed. And with those in favour, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the amendment passed. Professor Chun-keung, you have 1 minute and 41 seconds to reply. Then the debate will come to a close. I thank all the 40 members who have spoken on the motion on improving, promoting the development of CM, and for their valuable comments income. I hope the government would listen to them heavily and act to remove the obstacles and value the contribution of CM and take measures to promote the CM. As the first electrical members coming from the CM sector, I hope everyone would continue to support CM so that CM can contribute to a healthy Hong Kong. Lastly, I urge everyone to support my motion. I now put a question to you that Professor Chun-keung's motion as amended by Mr. Chen Hoi-yan, Ms. Joephy Chan, and Mr. Lee Chun-keung be passed. So, those in favour, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the motion as amended passed. I now adjourn the meeting until the 21st of June. 2023 will resume at 11 a.m.